for putting this together, because when we were starting out, there was there's no direction in what in where should we apply, and there was the resources were so limited. So we are very grateful that you're organizing this for everyone. I typically get at least 2 to 3 messages on everyday basis on, sir, how to apply, how to go for fellowship, or sir, just give me the fellowship. And some of them are probably very kind of direct in their approach. So I'll go very fast because I've listened to a few talks before me and they have covered the ground really well. I will try to be extremely fast in the topics in which they have already touched, but I'll be very specific on CV building, because a lot of times they say that you have to apply, but we actually don't know how exactly to apply, or what content to write in your emails, and what content to write in your CV, what content to write in the letter of recommendations. Because when you go for letter of recommendations, they will just ask you that, okay, how about you make something and you send it to me and I will sign it off. So those are the things I would like to highlight upon. I will also highlight upon my experience especially about research fellowship in the United States and also in South Korea. So so I do not have any financial disclosure for this particular talk. I have written a couple of articles on this in clinical orthopedics on what are the challenges which are faced by young physicians in India, especially, and why there are so many issues in getting fellowships, and what are the best ways to kind of get them. So in my clinical training and experience, initially it started after KEM. I did 1 year of bond in Sion, and that was enough time for me to kind of go around and build up my CV and show something for myself. And especially networking is something which I focused on, because the residency was so heavy that we could not really do that. So after that, I moved to Korea, Seoul National University, and in Johns Hopkins, I did my fellowship about 3 to 4 years. And before moving to Hyderabad for good, I did my 3 years of clinical practice in Dubai as a shoulder surgeon. So I'm very honored that the fellowships, and this is something which I wanted to tell you at the get go. It is not just about landing a good job; it is also about the recognition which you get. And I really think that I would not get any of the recognition which whatever little I have without having without doing those fellowships. So let it be being a member of American Shoulder and Elbow, or being on the editorial board of some of the prominent journals which we have. These doors open for you, and I wasn't seeking them. I never wanted to be that be on editorial board or something. This is something which happens to you over a period of time as you grow. So it is, fellowship and your career is really like a hike. Once you see a peak, once you reach there, there is another peak which you can see, and then you climb that. So I really think it's a marathon, it's a hike. You don't know what your end journey is, but fellowship is a really good place to start. So this talk is really for orthopedic residents and senior registrars, which I think most of you are. This is kind of like a short route on how to get overseas fellowship, and also they do not, the talks I'm going to give do not really require any exams. So I'll basically talk in these topics. First is the nerd guidelines for CV building on how to get fellowships, and I will touch upon South Korea and USA. And my second talk will be on how to write a fellowship application. These nerd guidelines, which I came up with, have been published in the newsletter of Bombay Orthopaedic Society. You can see it online. This basically, nerd means there's 4 steps. First is networking. The second would be exams, research, and diligence. So networking really, by definition, it means that you interacting with your peers to develop professional and social contacts. So the most important thing, which all of us have said in this talk and previous talk, would focus on the point you start is your local mentor. I get a lot of messages from people who are probably sitting in Orissa, who are in Hyderabad, or probably even remote places, who would come to me and, oh, sir, there is no one around us who have done a fellowship, and I'm doing an SR post for 3 more years, and I need to get some hands-on experience. I'm like, that is not really doing you any good, right? So you really need to be surrounded by. You have to move out of your comfort zone. You probably, as a senior registrar in the place you have done residency, you probably are known to everyone. That's your comfort zone. You are getting your surgeries, but that is not probably will not lead you to a fellowship. So I would really recommend them to move to an institute in which you would find a local mentor, and we will see what a good local mentor is. The step 2 would be to identify an overseas mentor, and as Supreet and others have mentioned that they really have been at least for me, a great support system to move on even after the fellowship. So Jack Ma in his famous video for Economic World Forum has said that in their different career priorities we should have, and I really believe as an orthopedic surgeon, our learning curve does not stop in residency. You cannot just start doing a specialist kind of work and do justice to your patient if you're not spend 2 to 3 4 years doing and working hours and hours and hours, and probably 2 3 years doing that specialty work. So 20 to 30 to 35 is the year when you should not worry about where your career is going, and you should not get impatient and work on refining your skills and essentially developing your skills, which you will use for the next 50 years of your life as your career. So, and what exactly is an ideal mentor? For me, I found it in Dr. Roshan Ware from KEM. And it is anyone who practices your chosen subspecialty, who would be academically active, either in meetings, either by publishing papers. He himself would be fellowship trained, so he would kind of know how to push you to it or how to get it done for you. And also someone who has an international network, who would be president of local societies, national societies, and so on. Those in my opinion, would be good local mentors to kind of see. They will also help you to kind of identify overseas mentors, because the best way you can find an international fellowship is by finding local mentors. I get a lot of people who send me messages on social media. They are saying, can you please recommend me for a fellowship? I'm like, this is the first time we are having an interaction. The first thing, even before saying hi and introducing yourself, if someone is asking me for a recommendation, that is not how it works. You really have to go and work with the local mentors for a few months, or at least publish few papers with them and prove to them that you are worth their recommendation. At least, and when I'm saying for me, I'm guessing that it's applicable for anyone else. That before giving a recommendation, we really need to know that it's kind of worth the word, because it also extends to our own reputation. The second thing, the best way to kind of find overseas mentors in international meetings and conferences, all you have to do is go and meet. And this is something which we really lack. We see we have anxiety in meeting new people, and probably mentors and those someone. And these are people with flesh and blood. So if you go, anyone, if you go to a place, probably a meeting, and someone comes up to you and talks, you feel good. So I really recommend people to just go and talk to people. If you see someone who is waiting for their coffee or waiting for their beer, just go and start talking to them, shake their hands, tell them who you are, tell what you want to do, and tell them that you're inspired by them, and if there is a way you can work with them. And that is how most of us have got our own fellowships. The last would be, of course, you have to go on PubMed and find your mentors. I mean, overseas mentors. So what I would do is, if I had to find a fellowship today in shoulder surgery and I don't know anyone, imagine I'm sitting in a very kind of peripheral place, and I do not have a local mentor or anything else, and I need to know where to apply. So the best way to do probably is to type your specialty, which is shoulder surgery on PubMed. You'll get whatever articles you get, and try to identify articles which are published with a very good impact factor journal, and go to that article, and you'll see this, as you can see here in the down. This will be like a letterbox, or this icon. If you click on that, there will be the email address of the senior author of that particular publication. Like this, you can find out thousands of people who are potential mentors. So the idea is to kind of, the idea is to send emails. You keep sending emails, as Supreet mentioned, and I think I surpassed Supreet, because I sent about 96 applications in about 3 years. I was working on them. For some reason, I just went into this zone of applying. Out of 96, 12 of them replied to me. And out of them, 4 of them had an intent, or they said that, okay, we may consider, can you please send our more documents or something like this. And after that, I landed up with 2 fellowships, which were which I could really consider. So it's really, the game is really about how much you apply, how many places you apply. So gather from your local mentors, from PubMed, from your local contacts, from internet, anywhere you find. As soon as you get the emails, you start applying. Now I will go to the part on how to apply step by step. And you really have to rigorously work on your fellowship application, send an updated CV and letter of recommendation. My next talk is about that, so I'll skip this one. So the second of the nerd guidelines, first was networking. The second would be exams for clinical fellowships. If you're looking for US research fellowships, there is no need for exams. Canada, I do not think has a need for exams. Also, South Korea will not have a need, for example, going for a clinical research fellowship. But if you want to move to South Korea, which I think not many of us would be actually willing, but it's very difficult to get a license. It's very difficult to also crack the language exam in South Korea. You have to top that exam, like you have to be someone like a native speaker. Then clinical fellowships in US definitely requires USMLE, and you don't have to repeat a residency in US to get a clinical fellowship. Just on the basis of your USMLE, you can get a clinical fellowship. But if you are planning to move to US, I think the job opportunities are much better if you have done a residency. So that's a completely separate path. The next is nerd guidelines to really boost up your CV would be research, and we do have a completely dedicated 1.5 hours of YouTube video on this, on what steps you need to take as a young surgeon with your busy practice or your busy routine on publishing, and how to be really productive in terms of research, because research is something, it doesn't happen. You cannot just sit around. You can sit around and your residency will get over, but you cannot just sit around and expect research to happen. So research is something which needs active effort from your side almost on a daily basis. So most of, if you do research and you have very good network who have recommendations, it's almost certain that you can land some of the other paid fellowship. Now, this is something which is interesting. A lot of people ask me on how to get fellowships which will pay you, because you cannot go unsupported for probably 6 months or 1 year. Plus, some of us have to support their family. Plus, some of us will need money to sustain in overseas country, because it's expensive. It's not that easy. So, in order to get that kind of support, you really must publish while you are in India. And research, like anything else, just like performing a total hip replacement or any other surgery, it's a skill set. So the first surgery you do is a K wire. When you put a K wire, and you go on from that journey slowly on to do more complex surgery. So research is just like that. You start with a case report, and next thing you know, you'll be leading world research in something, or being on editorial boards. So it always starts at zero. And also, I really would like to say that, oh, research is not for me. And this is what even when I was in KEM, that was the kind of thing which we had, that, oh, it's kind of boring, or you don't know how to do it, and blah, blah, blah. So it's really a skill set which we accumulate over a period of time as we go on. But the important thing is to stick with it and not give up. So for anyone who's a resident or SR, if you haven't published, please do publish. Your name should be there. And everything is about quality. When we review fellowship applications, we always see on someone who has published in a journal which is of high impact factor. Also, someone who's a third or fourth author, probably we know that they are not contributed as much as they should have in their manuscript. So being a first author really matters. Being on PubMed Index and high impact factor really, really matters. Another thing, the fourth and probably the most important part of getting fellowship or getting ahead in your career, which I have learned in my fellowships, is to have diligence. Diligence really is to do a job. You do it efficiently, but you also take care of the small details, and that is what will set you apart in your residency, in your SRship, in your fellowship, and in your career as compared to anyone else. The attitude towards your mentor should be of mutual growth. You should publish for him, and you should expect, you should give something before you kind of ask for a letter of recommendation, or you ask for a fellowship. The approach should be with hard work, and that is what it counts. It doesn't matter. We get emails and we get, people saying that, oh, you're doing good in life and blah, blah, blah. We are really inspired, which is all nice. But then after that, the questions that we ask is like, oh, have you really put hard work to whatever you have promising that you would do as my mentee? So, hard work is really important. And what really at the bottom of it, it doesn't matter how good you are at your work. If you're arrogant and if you're not really nice to people, it doesn't really count. You tend to kind of lose opportunities. So it is really important to be also very humble in your approach. So when you combine all of this with your mentors, that really builds up your CV. That you combine all of these things. This will your mentors will actually appreciate you. They will respect you, and they will talk behind your back very good about you. And this is something which has happened to me, which I realized that my mentors have been talking good about me. When they go for meetings, they'll say, "Oh, I'll send you the guy who's one of the best," or I have a perfect guy for you for fellowships, and that is what will land you the fellowship. Now, I'll be very clear. I got a research fellowship in Johns Hopkins when I did not have any published paper. I did not have a research paper, single one, and that is even then I got a fellowship because I had really very strong recommendations and had some things in pipeline. I was doing very good, but I showed my work, and that is what landed me the research fellowship. So your nerd guidelines is something which I would really stress upon as a pathway for you to build up your CV. So talking about South Korea, what we exactly it offers is, it's a joint specific practice. It is not like India, like an orthopedic surgeon is doing everything. Right now, we are moving towards joint specific or kind of specialty practice, but South Korea has have had that for many, many years. So you see someone who is doing a shoulder. If you go for shoulder, you see shoulder, and you'll see a very set up practice on what you would think your practice should look like after 5 to 10 years. So you kind of you adopt practices from there which you can actually apply in your own setting. Then you most of the people in South Korea will allow you to scrub in, but you need to confirm that beforehand. If there's some strict rules in which they cannot allow you to scrub in, probably you should look for another options. There is no hands-on surgery. You shouldn't expect anyone who is coming from other country without a license to kind of give hands-on surgery. They have a lot of opportunities of Sorbonne workshops, and that kind of keeps you busy with doing things on your own and kind of understanding the basics. You see, when you're doing a residency, you're so occupied with other admin work, you're so occupied with everything else that we don't really get time to sit and understand the scientific side of things. We really don't think of doing research. We don't really think we don't have time to do that. So research fellowships are really a good opportunity for you to focus on other aspect of patient care, other aspect of how to build up your fellowship, your CV, and how exactly to do your networking and spend time on it. It also South Korea also gives a fantastic kind of boost if you want to publish papers which are really prominent, which will get cited, and it will help you ahead in the future. And it is also a stepping stone for a US research fellowship or an Australian fellowship, or so South Korea basically for me is it's easy to get in, and it helps you to get more fellowships. So you should be on a ship to South Korea. I think somewhere in first or second, not the ship to, but probably you should try to board or try to kind of get into South Korean fellowships as soon as possible, because they are there to kind of pick up, and they are easy ones to get without much of effort. When to apply? As soon as possible. I would say anyone who's joined the residency, and when you decide that okay, I want to do this particular subspecialty, you should try to apply, because the waiting period is about 2 to 3 years, and now it is growing massively because of the information which is available on fellowships. Also, all the corporates need probably very well trained fellowship trained surgeons, and that is where the corporates are good. So if you're looking for those kind of job opportunities, you really need to apply fast so that you are in the picking order. By the time you finish your residency, you would be in that kind of top order to be picked up. And the optimal duration is 6 months to 1 year. Anyone who has done a residency, if just finished it, I would also always recommend a minimum of 6 months of fellowship. To go to a new country, it takes you 3 months to probably get used to a lot of things, and there is no learning. I also come across a lot of youngsters who come to me and doctor, and we just want a certificate. We want a certificate. You've done a fellowship, and we will paste it, and we will start working, and we will. No, that's not how it is. So you need to be very clear that you're not doing it for a certificate. You're doing it to develop a skill which you're going to use for next 50 years of your life to help real people and real patients. So if you have some superficial knowledge, you call yourself an expert or something, and when you go, your results will show. When you talk in the meetings, it will show. It will reflect the superficial knowledge, or the kind of not having the insights. So I really would urge everyone to kind of, if it's possible for you to do a 6 months or 1 year fellowship, it's really worth it. What you need for applying is updated CV, letter of recommendations, research publications. We'll talk about it in the next talk. Funding, how much the South Korean fellowships play. Most of the South Korean universities do have research funds, and they usually pay about 70K to 1.2 lakhs. I know it's not much, but it's enough to kind of sustain, because you'll end up spending half of it to kind of sustain that. Will language and food be an issue? That's another interesting kind of question, because we had someone who was very, very strict with the vegetarian diet. Even he survived for 6 months because he was getting to learn so much. So I really think that language is not much of a barrier, especially professors and the hospital staff will be able to speak with you. Yes, you will miss home more as compared to probably English speaking countries, but I do not think that that's a big what you get on the trade is really important. So I don't think that those are the big issues. Next thing about USA, and I will focus on US kind of research fellowships. When to apply, the rule is as soon as possible, and how to apply would be with a previous fellow or with your mentor. Second, and and nowadays most of the people who are having a good practice, and probably a lot of them have done their fellowships from somewhere. So people are very well connected. All you need to do is identify these people and kind of reach out to them. So I joined Apollo probably 2 months back, and no one has actually, no one. We have residents and we have other people who are post PG. They have not really come up to me and asking me for a fellowship or, sir, please help me out. And that I think is really, that's something they should utilize. That there are many other people who are fellowship trained in our department, and youngsters really need to seek out people who can help them. Another way we can identify potential overseas mentors is in United States is probably OrthoGate. This is one website which has a US and probably Canada fellowships as well, and also research fellowships, which keeps getting advertised regularly anytime they have, because US has very strict laws about visa applications. So if a lot of people who are selected cannot come because of visa issues. So the openings kind of, if you get lucky, then probably if you are in the selection order or you are in the list, someone gets cancelled, probably they will pick you up. So optimal duration is, again, research fellowship is probably 1 year would be 6 months to 1 year would be minimum of that is enough for you to actually make an impact. Publish probably 10 to 20 papers, and get your career would probably shoot up after that, and you'll be known internationally. A few weeks of fellowships is only for consultants who have already finished their they are in running practice probably 5 to 10 years, and they just want to update their knowledge. They want to learn a specific skill. They want to learn a specific surgery. Only for them, I would recommend a few weeks of fellowship. So don't really waste your time doing few weeks fellowship here and there. I would always recommend someone who's young and do have time to kind of do minimum of 6 months to 1 year of fellowship. So the rule of the game is to apply as soon as possible, and 90% of life is kind of showing up. The more emails you send, the more chances you will get in. So, and it's really important. A lot of people ask me for fellowships and they don't even have like a CV. So you need to. They don't have a structured CV. They don't. You have to kind of do a lot of effort on yourself to reach to a point where we can help you, probably as mentors. So we throw everything at the wall and see what sticks, and usually it does. Funding for US fellowships, yes, they are available. They are very coveted. There are many medical students who take research year gap. Anyone who wants to get into probably orthopedic residency, they would take 1 year research gap and they would do these fellowships, and they are paid usually about 3.5 lakh, 3.2 lakhs per month. So you really need to do, I believe that in order to get a US research fellowship, it is better to kind of publish some papers here and get good hold, or kind of show it for yourself that, okay, you have been productive even with limited resources, and that will boost your chances of getting a research fellowship abroad. And probably OrthoGate is a very good resource in which you can find out what are the potential research fellowships in the United States. So your research fellowship applies, kind of gives you or offers you, is an unmatched research experience. You will, it's one of the best ways you can publish papers. And if you develop that skill set very early on in your career, you realize that you are more likely to publish in future. You're more likely to be a national faculty or recognized in your particular field, because at the end of the day, all of us will get patients. There will not be less of patients, but what people really crave is the recognition from their peers, the recognition on international and national level. And if you have published papers early on in your career with these kind of fellowships, then it will definitely set you apart from your peers. You also, it's a fantastic way to kind of get job opportunities. If you have a tag of United States fellowship, then probably it puts you a little bit apart from your colleagues who do not have that tag. Unfortunately, I don't think it changes much in terms of your skill set as a surgeon, but your CV and how they can market you kind of changes. So that is important for the corporates. Another thing would be you'd be able to scrub, and there are very few centers would allow you to scrub actually, but you'll be able to observe surgeries, you'll be able to plan surgeries, you will be in touch. So it's not like you're completely sitting on a laptop. 75% of time I was in touch with the patients, or I was in the surgeries and OT, being associated with it. So yes, you don't get to cut, but at the same time you are working on learning a completely new skill set. And also it's fantastic for learning. Once you spend 1 year in US, you will know who's who in your particular field, and that will help you a lot in your future. So if someone is looking for a clinical fellowship, then 2 steps of USMLE are must. I would recommend anyone who wants to go to US, especially to settle down or to do a proper fellowship there, to start in second year of residency when they start to get enough of time. And it's kind of like a commitment which you do that, okay, I want to go on this path. Don't really. I really think that this decision has to be made in second year of residency, because after that things start to get a little complicated, even with the personal life. So once you are there, probably 2 to 3. Once you go to the US for a research fellowship, you have to do it for 2 to 3 years before you actually develop enough network to get a very good clinical fellowship. The letter of recommendation from United States surgeons are that will set you apart. Probably 20 plus publications if you have done in decent journals. That is what, and I'm talking out of my experience of being one of the one of the fellowship curators or the application curators in United States, and this is how they look at people, because they get a bunch of applications from people, from the surgeons who are from United States, Canada, and then there will be you. So you have to set yourself apart and be excellent in research and others. Then probably if you want to settle there, the best way to do is to kind of do a residency, which is again 4 to 5 years, and then you can do 1 year of fellowship. So that road of doing US clinical fellowships along with residency is of perseverance. But I can promise you, some of the biggest names in the world right now, probably Jawad Parvizi and others, have gone down this path and have become a legend. So it is really worth to do it. The quality of life and the quality of work you'll do will be worthwhile. So in summary of this particular section of my talk of US and Korea fellowships, is the node guidelines is something which I would recommend you to kind of follow. Korea is a stepping stone for your bigger fellowships, and United States fellowships are tougher, but they are definitely worth it. I do on my Instagram page, there is a link for on the highlight link for fellowship, and all the resources for different talks and different formats are available there. The next part of my talk, or the second talk, would be on fellowship application writing. This is after out of my experience of being a fellow for about 3 to 4 years, and also being on fellowship coordinators during my fellowship at Hopkins and also in South Korea, and also with the articles which I've written. So when you typically have apply for a fellowship, there is already 50 people ahead of you. So why should someone, that's something which you really need to think about, that why should they choose you? And as Dr. Sapil Kani kind of mentioned, that you really have to stand out your CV and your the way you present yourself, because that is really your first impression. Even if I'm a mentor and I say that okay, I'm sending a CV of this guy, or he will apply, but as soon as he will open the CV and he is not impressed, or it does not really, it's a poor show. You're not just losing your own credibility, but also of your mentor who has recommended you. So I really want everyone to kind of understand how important it is to focus on the fellowship application email, the CV you write, and your letter of recommendation. So let's first go to how to write a CV. So first paragraph should really about in an email. First paragraph should be really about who you are. It's really important to have professional email address, because I see sometimes when people are applying their Rajpool at 123 at Phadnis what. So it's like, it's really it's first impression. So you have to kind of put up a face as if you're serious about this. So probably I would recommend someone to have a professional email address. The subject should clearly mention what is the purpose of your email. The subject should not be uh, surajkumar.pdf, because you have attached your CV to it. So the subject should clearly mention that you're applying for this fellowship under your under for this particular hospital, or under this professor. So it has to be very clear from the beginning. The second thing would be how to address like respected sir, respected doctor, or respected professor. I had dinner with Professor Juano from South Korea in Bombay. I met him for a meeting. And he was like, Prashant, I get all these applications from India, and as soon as I see dear doctor, I just open that. I do not read any further, and I close, because they are really particular about being referred to as a professor, because it's kind of an entitlement which they have, which in Korea is really important. So you have to understand, wherever you are applying, you cannot just copy paste and apply to everyone. Probably in Australia, they like to be called, or it's okay for them to be called as Mr. instead of Doctor. But it's really important for you to understand how to address that particular professor or your doctor, because that is that is going to also decide if they're going to read your email further or not. The introduction, and if you don't know how to address them, just say doctor. Probably that is doctor/professor, and that is probably the safest way. The next thing would be on introduction. The first paragraph would really about introduction on who you are and who has recommended you. That should be in the first paragraph. It is very important that they see the name, a familiar name of someone who has recommended you. It should not be hidden somewhere down. It should be in the first paragraph that who your mentor who's recommending you, and also make sure that you write their complete designation. That I have been recommended by Doctor So and So, who is the head of department of orthopedics in this university or this particular hospital. So that designation will also add value to your application. The second paragraph should be about why they should choose, why you chose this fellowship, why it is important for you to be selected. Now, it's very important to be clear on this because then they know that you're serious. You are what you're coming for. Number one, are you coming to learn world class skills of your subspecialty? Are you coming there to publish papers if it's for a research fellowship? And you also see a potential for career of your growth, or you're planning to settle there, and that's why you want to go. Probably in Australia, you should not mention that, but in others, if you want to settle in US, then they know that you will be dedicated to kind of work on publishing papers and dedicated to work with them. So it's really important to be very clear on why you're choosing or why you're applying for this fellowship. The next would be why they should choose you, and this is probably the second most important paragraph after your introduction. Now, why they should choose you, especially if they're paying you money, what you're bringing to the table. Are you going to publish your papers? Are you going to publish papers for them? Have you shown in your past that you have published papers? The second thing is, are you going to be a very good teacher? Are you going to help them do surgery? In Australia, it is really important that they want someone with good surgical experience because they'll be expecting you to cover their costs. They will also expecting you to do a part of their surgeries. So if you have done previous fellowships and gained knowledge of that subspecialty, that will count, and that is something which should be mentioned. Your research has experience has to be completely mentioned. If you have any highlight of your career, of being on editorial boards or something like this, or even if small things of like arranging any meetings, organizing in meetings, and those have to be really mentioned. So this is the third paragraph is really important because that is when by then they have already made the decision. So you really have to promise in the last paragraph that you are committed. You're also very adaptable, probably to a new environment, and also you're kind of like a team player who would not have a problem with adjusting to the new environment. The attachments for this your fellowship application. So first, definitely would be your updated CV, and we'll see now what a CV should actually have. The letter of recommendations, and if you have a photo with the mentor, just like I had with Youngal Ree here, and if you have met them before in one of the meetings, and if you can attach that photo with that with your email application, that is going to help you a lot in getting recognized or selected, probably for consideration. Then a PDF of one or two of your published articles would be really nice to kind of showcase your research capabilities. The next would be how to write a CV. A CV should really have introduction, education, clinical training, your past employments, what you have done, memberships, and we'll go up, about this one by one. So always make sure that you have on the top right your updated. It should be really updated. Don't send their old CV, and it really has to be structured. So first, your name should be as passport if you're applying for US or any other fellowship because they will use that. All the admin people will use that for their official purposes. Then your current employment should be something which should really be next. Your take a professional photos. Do not take it on your phone. It's not that expensive to take a professional photo, and I would urge everyone after residency, during residency, to kind of take like a professional photo and try to brand yourself in a particular way. Then career of if you have any career highlights, that has to be on the top. It should not be somewhere down in your CV. It has to be mentioned just on the top so that they know that okay, they're dealing with someone who's recognized in a particular way. Then they should also on the top. What it should be is you have easiest way for them to reach out to you via email or something. It should be on the top. It should not be somewhere on the bottom. So this is what should be on the top of your CV. The next would be the next section in your CV should be about education, clinical training. So this is the proof of your core competency. A lot of people ask me if there is any difference between masters and DNB. I have not heard anyone having any issue for any overseas fellowship when they have done an MS or they have done an DNB. So I think all of them are equal. So another thing is if you have cleared the licensing exam, if you're applying for US fellowships, Australia fellowships, then that really helps them, and that should be clearly mentioned that you're cleared that particular exam. If you're cleared TOEFL or whatever the requirements are, that should be mentioned on the top. Your previous experience and previous fellowships have to be mentioned after that, and also highlight whatever experience you have in subspecialty. For example, if I was working in KEM, I would write down that I've worked with Dr. Roshan Wade, who is one of the leading arthroscopy surgeons in this particular part of the world, and that is how they would recognize you. So that has to be your experience in subspecialty where you're applying is really important. Then your membership of subspecialty societies. It is really important that you make, don't, it's important in life not to say yes to everything. You really have to be very selective. If you have chosen probably joint replacement as your subspecialty, then you should try to be in members of those associations only, because that tells the mentors that okay, so you have been associated with these academic institutions at the local level. You have been working with them, which means that you are dedicated to that specialty. It shouldn't happen that you go for a spine fellowship and when you go home you're doing joints. So that's kind of like a confusing, that portrays you as someone who's confused. So be very careful in which societies you're joining. Don't just join because they're available, and make sure that it is highlighted in your career, in your CV, that you are a part of these committees. Then any awards which you have listed or which you have received should be listed, which is really important because it's a proof of your excellence. Best resident, best paper, top reviewer, whatever you get. And yeah, start reviewing for journals. That is really important. Even if you get Indian journals, and if we are doing fantastic job with Indian Orthopedic Journal, IJ, and we also the JOCR with Dr. Ashok Sharma. I think they're doing fantastic job, and you should be associated with them. Try to be one of the reviewers, and you will learn with every review on how to publish as well. So this will help you grow as an academician. Your recent publications would be the next in the list of your CV format. You will list. It has to be in the sequence of based on the date of publication. Don't just haphazardly, unless you have a very strong kind of publication which you want to highlight. You can put it on the top. And you use, I have seen a lot of people mentioning only the title of the publication and not mentioning where it was published, and so it has to be in the PubMed NLM format. Also highlight your name in each and every one of them, and try to give the DOI link, so that once they click on that, your article should open. So make it easy for them to find you for research, kind of recognition for research. So research presentation should be the next list. This is and this is something which residents can definitely do. Try to be present, and when you go for the meetings, try to be presenters for posters and podium. They really count later on. And please do mention which specific meeting which it was, because I see half cooked kind of CV sometimes, and that really is not nice, because it really adds that even if you have published something on a local level, it has to be mentioned in great detail. Then this is and whatever non-research public presentations which you have, if you're working with a mentor and he is going for a talk, or he is going for if he's going for a presentation, and you have helped them to make that presentation, you can ask them, is it okay for you to add my name? I know you are giving the talk, but is it okay? And it's really important for you to kind of reach out with this kind of request. Maybe they will say no, but most of them will not. If you have helped them to make that presentation, then they should be able to accommodate your name as one of the co-authors, and you can add that in your CV. Now, reference is probably the most important section. You have to really list your mentors, list the mentors who are of your subspecialty first. Mention their emails, phone numbers, and they do email, they do call, and they do confirm. So make sure that you tell your mentors or your referees that you may get a call and an email because I have applied for a particular fellowship. So they are aware. Even if it goes in spam, they can seek it out and they can reply on your behalf. Last would be the letter of recommendation. What exactly should letter of recommendation format? There are thousands of them online which is available. You can take help of them, but this is how I like letter of recommendations to be. This was given to me by McFarlane from Johns Hopkins. So it should be on the letterhead of the particular institute, and the title and the contact info of your mentor should be right on the top so that they can easily be reached out. The first paragraph of the letter of recommendation should really be about what exactly is this letter. Like, you are recommending this particular doctor for a particular fellowship. The more specific you are, the better it looks like. It looks like you have not just copy pasted and one letter for all your fellowships. or probably not copy paste it, just one for all your job opportunities as well. So the more specific you are, kind of gets better. The next paragraph should really be about your professional competency, in which your mentor kind of mentions how long they have known you and at which capacity. He was a resident with me. He was a fellow with me. Then how you were different than other residents. Yes, I know that you can hype up yourself a little bit, but at the same time, if your mentors kind of take some time to kind of write something which is very specific about you, which is genuine, I think that hits the chord with the overseas mentor. Honesty is definitely something which will be counted, and also the reputation of your mentor, uh, that is something also which will be counted, because your word matters. What you are If you are recommending someone, then it will matter. If I know someone, and if, for example, if Nandan, Marathe, or other people I know would be recommending me, I will take that very seriously. I know that they will not recommend someone without someone with real worth, or someone who would be really, really resourceful and helpful for us in our fellowship program. So another thing, the last paragraph should be about personal virtues on the diligence, the character, and teamwork, and they are really important when it comes to especially abroad fellowships, because a lot of people who are very competent, they go for fellowships and they unfortunately uh, they just leave midway because they cannot cope up with the change in the environment, with the culture, with the food habits. So you really have to, in the last paragraph, the mentor should write down letter of recommendation that this guy is very adaptable. He's going to seamlessly go into your whatever system you have and help you out as a team. Another thing is, I've seen a lot of people kind of writing, trying to be very fancy, and that doesn't really help. You have to stick to the basics. Use 2 to 3 formats when it comes to font and size, and be very unnecessarily. It's not important to kind of put things in capitals or put things in bold. So your CV really has to be very simple and legible and concise. Uh, you know, Most of the times we try to catch attention about something, and that leads to things looking silly. So please try to avoid that. Your grammar and spelling check, it's really, really important. It really shows that you're very, very sincere in your work. And avoid sharing your personal information about, I personally don't like to put my birth date and everything else. Probably if they ask for it, you can share that. So this thing is that the resources are available there on my Instagram channel. There's a fellowship link on which you can get on what the formats is, and all the information about how to write the CV, LOR, and applications. The take-home message of this unfortunately long talk for you guys, but it really helped me, and this is kind of like the insights which I've gathered over a period of years of during my fellowships, and also after that on guiding people on how to get fellowships. So you should apply for fellowships as soon as possible. The first impressions really matter, so you need to work a lot on writing your fellowship application really well, and also your CV. And please follow nerd guidelines to kind of build up your CV. So the first step is usually the most difficult one, but then you never know what next peak do you have. And we all started as singularly without any support. So it's really important for us to keep growing together. So once you have gotten a fellowship, make sure that you help the next one to get it. Thank you so much for your time, and thanks for having me.